Colleges and universities in the state struggle to stay ahead of the coronavirus. Are they properly prepared to educate students during the pandemic? As we go into the fall, are Arkansans remaining vigilant? And are we prepared for what is ahead? Arkansas got $1 billion in COVID funds. How has it been spent and what is left? These issues and more coming up on Arkansas Week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello, everyone. Welcome to the program. I'm Dr. Malcolm Glover, filling in for my friend Steve Barnes. Well, the COVID-19 coronavirus pandemic is still with us. And although there was a brief slowdown in the growth of confirmed cases, there has been a slight increase in recent days. Reports of cases popping up on college and university campuses in Arkansas is concerning for many people. To date, a few universities in the state have already sent students home for engaging in practices that may have exposed them to the virus. At last check, the University of Arkansas had 888 active cases and reported that over 300 students were quarantined or in some sort of isolation. Fluctuating rates of virus transmission and its impact on higher education is where we begin our discussion. Joining me now, Dr. Maria Markham, who serves as director of the Arkansas Division of Higher Education, Chancellor Joseph Steinmetz of the University of Arkansas, and Dr. Namver Zohoori, Chief Science Officer for the Arkansas Department of Health. Thanks to all of you for being with me. Let me start off with Dr. Zohoori. Are there specific areas of the state where we are seeing increases in COVID-19 cases? And if so, what seems to be the cause of the increases in those areas?
Well, as you know, the numbers fluctuate quite a bit from area to area. We just looked recently actually at the growth rate in various regions in the state. And there doesn't seem to be a major difference in the various regions when we look at the regions of the state generally. Growth rate is over the past week to 10 days has been about 6 to 7%. Where we are seeing notable differences is more in age groups. While all age groups are also growing at a rate of about 6-7%. The 18 to 24 year age group is the one that has increased over the past couple of weeks at a rate of about 17-18%. And a lot of that is due to colleges, as you mentioned, and University of Arkansas in Fayetteville has had a large number of cases, and that is where we're seeing some of the increase in that area of the state.
Based on that, I'm wondering, Dr. Markham, when you hear that rates are increasing, particularly for that 18 to 24 age group, what are you hearing in your conversations with college and university administrators or state lawmakers about what needs to be happening right now to help protect students, faculty, and staff?
Right. I think that it was not surprising to most of us that we saw the increase. We expected some level of increase when universities and colleges resumed. The question is, how can we mitigate the amount of the spread? How can we control that? So I think we've already learned some valuable lessons on the guidance that we've given and the enforcement that we want to give. So we want to allow for learning to continue, but in a safe environment. So at this point, we're reevaluating our plans. How effective are they? Are they being followed with integrity? And how can we improve upon those?
Chancellor Steinmetz, I know we were talking earlier about how one of the things you're trying to do is make sure you inform different stakeholders of the University of Arkansas, updating them on the status of the situation there, so numbers may change when you release your next report. How are you keeping students informed? And what, if anything, can you tell us about how you're alerting them and making sure faculty, staff, and students are prepared as you make the decision on whether or not to move to remote learning?
Yes, we've been communicating rather frequently with the campus environment, not only the students, but the faculty and staff as well, about the status of the virus on campus. So one of the means is we have a dashboard that gets updated every Monday, Wednesday, and Friday, usually sometime in the late afternoon, that has the latest numbers of the number of tests that's been done, the number of positives, the positivity rate, and some other information. The other thing we've been doing at least once or perhaps twice a week is messaging out to the campus how to stay healthy and how to stay safe, where we're picking up issues with the virus. With all of that said, we believe our campus environment itself is very safe, and we're getting good compliance on physical distancing, and that's been highlighted in some of these messages, as well as the mask wearing. Where we're having difficulty is in the off-campus environments, which we can't monitor nor can we control as easily.
Dr. Zohoori, we are about to enter cold and flu season in these winter months, and there have been some concerns out in communities about what will this mean as people start trying to do their best to combat that and combat COVID. What are some of the things that you think we need to be thinking about so that we can be prepared?
Very good question, and it's something that we are also concerned about and have discussed and keep discussing. Yes, we are moving into flu season. One of the things that we don't know is we've never had these two viruses coexisting at the same time. So one of the things that we're wondering and don't know is what is the effect of having both viruses at the same time. One thing that I think everybody should realize is that these are two different viruses. The same person can be infected with both. Both of them can cause serious illness. They can cause pneumonias, respiratory problems, and a number of other issues. And having both of them at the same time can be catastrophic. And you really don't want to have both of these viruses at the same time. One of the most important things I think the messages that we want to get out is that getting the flu virus is probably more important this season than even before. I think some people may be thinking that we don't need to get the flu virus. We're at home, we're socially isolating, we're wearing masks, but the fear of having both of these at the same time, and the fact that we really, as I said, don't know what the coexistence of these two viruses at the same time might cause. So it becomes even more important to get the flu shot and be prepared for that as we move into the winter months.
Dr. Markham, I know part of your mandate is to help certain colleges and universities in the state improve their delivery of key education services. And as you know, we live in a state where there are a lot of students, both traditional and non-traditional, who come from certain socioeconomic backgrounds where in their communities they may not have good broadband service, or they may not even have a computer or laptop at home to continue their education if we move to remote learning. What, if anything, do you think you and your team can be doing to make sure that students who want to get a quality education, higher education, are able to do it if we have to move to remote learning?
Well, it's a serious concern, and we saw this in the spring when we moved to remote learning, that some of our state infrastructure to provide broadband and connectivity is just not in place. And even though we've got resources dedicated to expanding those broadband areas in the state, it won't happen in time for the fall to be impacted. So one thing that we've done is we've provided a map of the state with parking lot Wi-Fi. So all of our institutions have opened up their Wi-Fi availability to all students. So if we have students who are in school at Arkansas Tech, but they live in the Delta area and they go home to that area because of a shutdown, our two-year colleges in that area of the state have opened up their Wi-Fi so that students can socially distance, they can drive up to the campus in their car and they'll be able to access the internet. And we also have had most of our institutions who received their higher ed emergency funds from the federal government as part of the CARES Act. They've used that money to purchase laptops, Wi-Fi hotspots, and other resources for students who may not be able to afford those on their own. So we're doing what we can with the resources that we have to address for the fall. And then we're looking at long-term solutions, expanding broadband throughout our state so that should we have this situation in the future, we'll be better prepared to address that.
Really, this pandemic is changing the face of higher education, and we're having to rethink and reimagine how we give a quality education to diverse students in Arkansas. I'm wondering, Chancellor Steinmetz, in many ways, you're kind of sitting in the seat for a lot of different college and university administrators who aren't on the program today. Of course, you're running your institution, but many other men and women are having to grapple with some of the same issues you're dealing with. And as I prepared for the program today, one of the things that I heard from college students is, you know, we're paying tuition and fees, and the experience that we're getting is very different than during a normal school year. So what are you trying to do to make sure that even though students are paying these high rates, they're still getting a quality experience? And if by chance you have to make the move to remote learning at some point in time this fall, how will you make sure that students who may come from disadvantaged backgrounds have enough lead time so that they can get home and do what they need to do to actually complete the semester off right?
Yeah, so and part of this is a follow-up to what Dr. Markham was talking about. We've worked hard on this campus to provide the technology for people to succeed in this environment. So we really ask our students one by one, if you're struggling with the technology and the delivery, et cetera, let us know. We'll help you solve the problem. So that's part of the different kind of use of expenditures or use of revenue at this time that we have. And so that message really has to also go out to our students that are disadvantaged, because they are the ones that have the acute need at this particular time. To keep the quality up, we really have to keep reminding ourselves the difference between remote learning and online learning. This is a confusion that some people have. Online learning is, if you will, the complete program or the complete class is available at any time for people to take a look at. It's web-based. It's typically not guided much by live instructors. The remote happens in real time. And is synchronous, so that has challenges to it to deliver the kind of quality the students would get while they're in the classroom. So that has, we've had to expend resources and places to increase the quality of that remote delivery such that the students are getting that quality experience. And so if we had to pivot, we would pivot towards the remote types of classes. And for example, we would probably have our instructors delivering their classes from the classroom that they would be teaching live face-to-face. And that's important because that's where the technology exists and that's where the resources exist to make this a high-quality experience.
Dr. Zohoori, we know the mantra about wearing masks, washing hands, physical distancing, and you talked to us earlier about how it's going to be important for people to get their flu vaccines. What else moving forward should we all be doing to keep ourselves safe and our loved ones safe?
Well, I think you've hit the nail on the head in terms of keeping ourselves safe and also others. That is what really we're trying to do. It is about protecting ourselves, but it's also about protecting everybody else, because this is a very highly contagious virus, as we all know. That mantra of washing your hands, wearing a mask, and keeping your distance is actually a very important one. So we keep emphasizing that one of the reasons we keep emphasizing is that not only do we have to do those things, but we have to do them right. So the washing of hands, at least 30 seconds with soap and water to make sure that the germ is washed off. Wearing the mask, really important to wear it correctly. There's so many times we see people having a mask hanging from their ear, over their chin. The mask has to really cover the nose and the mouth and have a good fit so that it does not allow air and particles to escape from that mask. And then keeping your distance, the 6 feet, that is really a guideline. So 6 feet is the guideline we're going by, but there are certain circumstances where we even recommend greater than 6 feet. If you're attending even outside, standing there talking to people and they're singing, or if you're at a church, there's singing, if you're in a classroom and somebody's speaking, making presentations, those kinds of activities tend to project those droplets even further. So in those kinds of situations, we recommend even maybe 10 or 12 feet. Also, wearing a mask doesn't mean you can get close to the person. You still have to maintain that 6 foot distance. But I think the most important thing that especially on college campuses, I would emphasize is if you have symptoms, if you feel sick, if you've been tested positive, please don't go to classes and don't go to social activities. Isolate yourself, quarantine yourself, contact the healthcare system either within the school or your healthcare provider. And please make sure you let the college campus or university campus know that you've tested positive. There's no shame in that, but that will help the campus to be able to provide the necessary circumstances and services to protect everybody else.
Protect yourself to protect others and save lives. Dr. Zohoori, Dr. Markham, and Chancellor Steinmetz, thank you so much for your time. When schools shut down last spring, Arkansas PBS teamed up with the Arkansas Department of Education to produce and air educational instruction across the state. This was critical for areas without access to broadband or other methods of instruction. However, there were gaps in our coverage where some of those most in need could not receive our signal. The Arkansas CARES Act Steering Committee, which I will talk about more in a moment, recommended $5.2 million to install additional transmitters to fill those gaps. That appropriation was approved and the process has begun. The governor appointed the Arkansas CARES Act Committee to make recommendations on how best to allocate the $1.2 billion Arkansas received from the Federal CARES Act. There were two main conditions. It had to be related to the COVID crisis, and the funds must be spent by the end of this year. The chair of that committee is the Secretary of the Department of Inspector General Elizabeth Smith. She joins us to discuss the committee work thus far and what is left to do. Secretary Smith, thanks for being here. $1 billion received. I'm wondering if you could ballpark it for us in terms of what has been spent, how much is left, and what you think has been accomplished so far.
Thank you. Yes, we received $1.25 billion from the federal government. We began by addressing immediate needs such as PPE for hospitals and for the state. I know at the very beginning, even before we received the funding, the governor allocated $75 million in funding for that. So we've replaced those dollars. We allowed for critical care payments to assist in healthcare workers to make sure that they had continuity of care. We did not want the healthcare workers to, we wanted the healthcare workers to continue coming to work. So they received continuity of care payments. The Ready for Business Act came through, Ready for Business Grant came through, and that was approximately $147 million. So many businesses were able to apply for that, specifically small business and nonprofit and small businesses and minorities. We have also, as you speak to the broadcast dollars that we allocated, we had $100 million go to broadband, and the internet service providers have partnered with us to reach areas that have not had broadband yet. So that is a critical need for our state during this time while many children are at school virtually and many employees are working virtually and from home as well. So we've addressed a number of needs across the state. I haven't given you dollar values yet.
No, absolutely. Please go ahead, particularly when we think about what might be left over.
So what might be left over? We just allocated $150 million to the cities and counties through the Arkansas Municipal League and the Arkansas Association of Counties. So each city will receive direct funding and each county will receive direct funding in a reimbursement process for items associated with COVID. So those dollars haven't gone out into the communities yet, but they're on the way. We also have dollars that are coming back to the communities through the business grant for business interruption, where the government had required shutdown or limited entry into restaurants, into hotels, and such for travel, so that we have $50 million coming in to that arena. Hopefully the legislature will approve that recommendation that we made on Wednesday. We have $250 million that the governor asked us to set aside for the fall to see where we are related to the pandemic and related to the other needs of the state of Arkansas. We have a few dollars that will be coming back from allocations that we have already made that were not able to be spent for various reasons. So we do still have some money that we are working on finding the right place to cover the need for.
There are a lot of moving parts and a lot of money that still needs to be spent. I'm wondering if there are businesses, communities, or individuals right now that want to access some of these funds. How do they go about doing that?
So the way that the CARES Act funding has worked is the state of Arkansas received these dollars from the Coronavirus Relief Fund, and the federal government allowed these funds to be directed by the state rather than other funds that were specifically earmarked for education or healthcare or agriculture. And we receive these dollars. We are looking to our state agencies and state departments to assist us with those needs. So we have set up grants and programs for application. So we are putting out the information for that. You will soon be seeing the information related to the business interruption grants. You see a lot of information related to the Ready for Business grant that has now closed. We have grants that have also been completed from Department of Human Services. We do have a comment box on our website. If you go to the governor's website and then click on COVID, the CARES Act Steering Committee has their own page there. It's the last note on the list. If you'll click there, there's a comment box and a proposal box, and you're welcome to submit your request or your proposal or your comment there, and we will review that.
Secretary Smith, I know that this money has to be spent by the end of the calendar year, but it's pretty safe to say that the pandemic will continue into the new year. And so when you just think about some of the different cases that you've heard about, some of the money that's been spent, if you had to tell us what you think needs to happen come 2021, what do you think should happen so that we can make sure that communities and businesses and individuals still have the support that they need?
Right. Well, what I can tell you is the dollars that were allocated to the state of Arkansas and all the other states across the nation through the Coronavirus Relief Fund was specific to this time period. We were in a crisis on March 27th when they allocated these funds to the states. They anticipated, I believe the Congress anticipated the need right now. It was more for the need we have now rather than looking towards the future. They knew we had businesses that were being closed. They knew we had medical needs that needed to be met. They knew we needed to buy PPE and other equipment that were necessary to deal with the pandemic then at the time. The state received the dollars very quickly after the Congress passed the act. I think we had a first half of the money within about 2 or 3 weeks, and then the rest of it before the end of April. So we have been working to spend these dollars as quickly as we can because they need to get back into the community. They need to serve the needs related to COVID that we're seeing now. Hopefully, the federal government will allow for additional funds after the first of the year. But right now, we are looking to address the needs with the dollars that we have currently.
Well, Secretary Smith, more to do and a little time to do it, but we thank you for joining us.
Thank you so much.
We are out of time, but I do want to acknowledge that this show will first air on the anniversary of the September 11th terrorist attacks in 2001. It's been 19 years. We shall remember that day and continue to honor the memory of all those who have given their lives for the cause of freedom. I'm Dr. Malcolm Glover. On behalf of my friend Steve Barnes and the entire Arkansas Week team, thank you for watching.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.